Hello, my name is Jason Janey with the University of Charleston. Today we're going to talk about acute pancreatitis. The definition and etiology of acute pancreatitis refers to an acute inflammatory process of the pancreas, usually accompanied by abdominal pain and elevations of serum pancreatic enzymes. This syndrome is usually a discrete episode which may cause varying degrees of injury to the pancreas and adjacent and distant organs. Your pancreas sits behind your stomach and in front of your spine. Your gallbladder, liver, and spleen surround your pancreas. The right side of your body contains the head of your pancreas. When we talk about the pancreas, we need to think, what does the pancreas do? The pancreas produces digestive juices and insulin, as well as other hormones to do with digestion. The part which produces the digestive juices is called the exocrine pancreas. The part which produces hormones, including insulin, is called the endocrine pancreas. So let's go and talk about what the digestive system does. The digestive system breaks up the food and digests it. After about 2 hours in the stomach, the partly digested food moves into the beginning of the duodenum. When the food reaches the duodenum, the pancreas releases its digestive juices, which flow down the pancreatic duct and mix with the food. The juices contain enzymes that help to break down the food into very small fragments. These fragments are absorbed into the body through the small bowel. Now, let's talk about the pancreas and insulin. The pancreas makes insulin. Specialized cells within the pancreas releases insulin directly into the bloodstream. Insulin keeps the level of sugar or glucose in the blood at a stable level. This means that the body cells get enough sugar, but not too much. The pancreas makes and releases more insulin if the level of sugar in the bloodstream is high. If the level is too low, it releases less. You have a condition called diabetes if you don't make enough insulin. Acute pancreatitis is a condition where the pancreas becomes inflamed or swollen over a short period of time. Most people with acute pancreatitis start to feel better within a week and have no further problems. Some clinical manifestations of acute pancreatitis include upper abdominal pain that radiates to your back, tenderness when touching the abdomen, fever, rapid pulse, nausea, vomiting, sudden, steady, intense epigastric pain centered close to the umbilicus and radiating to the back between the 10th thoracic and the 6th lumbar vertebrae that lessens when leaning forward, pain aggravated by consuming fatty foods or alcohol, walking or laying down, and relieved by sitting up or leaning forward, also bloating and diarrhea. Acute pancreatitis occurs in more than 200,000 people each year. Acute pancreatitis affects blacks more frequently than whites, especially in males ages 35 to 64. Acute and chronic pancreatitis are slightly more common in men than women. Acute pancreatitis can occur at any age. Chronic pancreatitis commonly affects those older than age 45. Regarding the pathophysiology of acute pancreatitis, the exact trigger or mechanism that initiates enzyme activation is unknown. The most common cause of acute pancreatitis is having gallstones. Gallstones cause inflammation of your pancreas as stones pass through and get stuck in a bile or pancreatic duct. This condition is called gallstone pancreatitis. The most common causes of both acute and chronic pancreatitis are gallstones, heavy alcohol use, genetic mutations, drugs such as sulfamides and diuretics, blunt or penetrating abdominal trauma, obstruction of the ampulla, pancreatic ischemia. Other risk factors are smoking, obesity, biliary cyst, abdominal organ structure that's abnormal, family history of pancreatitis or pancreatic cancer. Some diagnostic and testing for acute pancreatitis include blood tests. A healthcare professional may take a blood sample from you and send the sample to a lab to test for high amylase and lipase levels, which are digestive enzymes made in your pancreas, high blood glucose, high level of blood fats called lipids, Signs of infection or inflammation of bile ducts in your pancreas, gallbladder, or liver, or pancreatic cancer. There's also stool tests. Your doctor may test a stool sample to find out if a person has fat malabsorption. And for imaging, we would do ultrasound, CT, MRI, endoscopic ultrasound, and a pancreatic function test. Some complications of acute pancreatitis include kidney failure. Acute pancreatitis may cause kidney failure, which can be treated with dialysis if the kidney failure is severe and persistent. Some others are diabetes mellitus, massive hemorrhage, shock, coma, acute respiratory distress syndrome, atelectasis, pneumonia, paralytic ileus, GI bleeding or obstruction, pancreatic abscess and cancer, chronic pancreatitis, and malnutrition. Another complication is pseudocyst, which is behind me. Pseudocysts are collections of leaked pancreatic fluids. They may be formed next to the pancreas during pancreatitis. Also, the worst complication of acute pancreatitis is death. Some nursing interventions for acute pancreatitis is to give IV fluid therapy as ordered and ensure the patient has a patent IV access, administer pancreatic enzyme replacements with meals, obtain finger stick blood glucose levels, and administer insulin as ordered, because this may affect your insulin. Encourage the patient to express feelings and concerns, provide emotional support, maintain NPO status until pain and tenderness resolve and the GI motility returns. Make sure to obtain daily weight and insert an indwelling urinary catheter if indicated to elevate urine output and kidney function. Monitor hourly. Screen for and assess the patient's pain using facility-defined criteria that are consistent with the patient's age, condition, and ability to understand. Some of the things for patient education would include the dietary needs, including small, frequent meals that are high in carbohydrates and low in fat and protein. The importance from staying away from alcohol and also to stop smoking. Make sure that you know the continued follow-up schedule for your doctor's appointments, including laboratory testing to evaluate the effectiveness of therapy. A nurse's judgment is important and used to help assess the patient and providing nursing interventions to relieve symptoms so the body can recover from acute pancreatitis. Now it's question and answer time. Class, do you have any questions? Yes.
What is the most important intervention for acute pancreatitis?
Awesome question. Acute pancreatitis is a frequent and potentially life-threatening disease. Therapy is currently mostly symptomatic with fluid resuscitation, pain management, and early oral feedings. Vigorous fluid resuscitation remains a cornerstone of early management of acute pancreatitis. Is there any other questions? Yes?
What is the most common complication of acute pancreatitis?
The most common complication of acute pancreatitis, which is occurring in approximately 25% of patients, especially those with alcoholic chronic pancreatitis, is a collection of pancreatic juices outside of the normal boundaries of the ductal system called a pseudocyst. All right, we got enough time for one more question. Anybody? Oh yes, you in the back.
How can acute pancreatitis be prevented?
Awesome question. The way it can be prevented is to maintain a healthy lifestyle or lose weight if needed. By keeping your body at a healthy weight, you can make sure your pancreas works better and reduce some risk factors of pancreatitis. These include gallstones, obesity, and diabetes. Eat a balanced, low-fat diet and exercise regularly. That's it for acute pancreatitis. Thank you.